Hi everyone, welcome back to Beyond Your Knowledge. So today we are going to be studying muscarinic receptors, and before we continue I would like to share with you Isaiah 32:17, and says that the effect of righteousness will be peace, and the result of righteousness quietness and trust forever. Amen. So it is so righteousness bring peace. Who is the righteous? God, Jesus. Just go to him. So in the muscarinic receptors, so we're going to see that there are, for example, M1, M2, M3. Okay, so let's just start. We're going to have here the receptor. We're going to the table. So you're going to have the target or the target organ or organs, the target organ or organs. So you're going to have the effect of a stimulation, and then we are going to have the other one that we need to see here is the the effect of inhibition. So the effect of inhibition. Got it? So this is all those things that we are going to see here. So since receptor, so we don't need too much receptor, not too much space there, but okay, so I think that probably with that is okay. So let's just start up. So try to come here, and then the target organs, the effect of stimulation, okay, and then the effect of inhibition. Okay, and let's see. Okay, there we go now. Okay. I'm going to copy this table because I'm almost sure that we will use it a lot. When I say a lot, don't get scared. So just a few slices probably with that. Okay. And then just one more slice here. Slide. Okay, so probably those is okay. Okay, so let's just start. So the first receptor we're going to see is M1. So which one? M1. So where M1? How many? What is the most important organ in your body? Is your brain. So M1 is in where? So it is in your brain. So what happened to your brain if you stimulate the M1 receptors? If you stimulate it, it's going to cause memory formation, and is going to memory formation and cognitive functioning. Okay, cognitive functioning. So it is good. So if you stimulate your M1 in your brain, because you get a memory formation, you get a cognitive functioning. But what about if you inhibit the M1 receptors in your brain? So the patient is going to get confusion. Oops. So now if you have for any reason stimulation or inhibition of your M1 receptor is going to cause effects. So the effect of inhibition is going to be confusion, and the effect of stimulation is going to be memory formation and cognitive functioning. So that was the M2. Now if the most important organ in your body is your brain, the first one, what is the second most important organ in your body? which is important. So it's going to be your heart for this reason. So M2 is going to be in your heart. But what about if I stimulate my M2 in my heart? So that means that my heart will be decreased. So the heart rate and the atrial contraction both is going to decrease. So that means that it's going to cause decrease of the heart rate. So decrease of the heart rate and atrial contraction. So that means that my heart rate is going to feel more slow, is going to decrease by the stimulation, of the M2. But if I inhibit my M2 receptors in my heart, it's going to increase your heart rate. So it's going to increase your heart rate, and also it's going to increase your contractility. So that means that until now, so if you inhibit M1 or M2, you have negative symptoms. So because if it's in your brain, you get confused. If it's in your heart, when you inhibit, so that means that now you are going to have more contractility. So that means that now you're going to have more, the heart rate is going to be higher. You're going to increase. Okay, M2. Let's just talk about M3. Probably you are mentioning or thinking, and if you didn't, I was thinking while I was writing, I said, okay, but I wrote organ or organs. So, but until now we saw 2 organs, but each organ is for the 2 receptors that we learned. But don't worry about it. Now come M3. M3 has a multiple organs. So, but we are going to start with a few of those. So the first one that I would like to start is, for example, with your skin. Let's just start with the skin. So M3 receptor in your skin, what is going to do? So if you stimulate, what I said, if you stimulate your M3, now just think in your skin, you are stimulating your skin with the M3. So that means that you are producing more sweat. So that means that increase your sweat production, which is good. Well, sweat is good if we're working out, but if you are just sitting or lying down, you start to sweat and you don't do anything, you need that should be check it out, because this is not normal. Depend, okay? So could be patient is hypoglycemic or something, so depend. Well, but if you, now let's just come back to the table. If you inhibit your M3 in your skin, what do you think is going to happen? So remember that when I stimulate my M3, I'm sweating. Because I'm sweating, I'm releasing heat. One of those examples. I mean, yeah, sweat, but at the same time, my pores are open, so the heat come out, all those things, okay? Now, but if I inhibit my M3 in the skin, so it's going to increase your temperature. This is worse, temperature. So increase your temperature, and why? Well, makes sense. The opposite of the stimulation is inhibition. So because from decrease sweating. Yeah, so this is the M3 for the skin. We can see a few more on this slide, and then we can move on to the other one, but we continue with the M3. Okay, so the other organ that we're going to see is your bladder. Let's talk about your bladder. So You get a spleen. Now M3, now if I'm using my M3 in my bladder and I stimulate my bladder with the M3, so I'm going to cause the detrusor contraction. Okay, the detrusor contraction, and it is important contraction because why? The detrusor, I mean, I wrote it away, I just want to have more room. The detrusor contraction. Yeah, it is important that you contract your detrusor muscle because that makes you pee. Okay? But if you don't, if you inhibit your M3 is inhibited and your pee is inside. So that means that this is called the detrusor relaxation. So your detrusor relaxation, okay, and what do you think is going to happen with the urine? Yeah, it's going to so it's going to be inside, urinary retention. So urinary retention. Got it? Cool. Now that was the bladder. Let's just talk about the lungs. So I'm going to open a new slide here. So we continue with the M3. Okay, so this is M3, and now we're going to talk about the lungs. What do you think my M3 in the lung is going to stimulate? So in the lung, so it's going to cause bronchoconstriction. And if I inhibit the M3, it's going to cause bronchodilation. So this is related with it is all those. It is important that those M3 in the lung play an important role in asthmatic patients. Okay. Now, what about your peripheral vasculature? Peripheral vasculature, M3, your peripheral vasculature, if you stimulate, it's going to cause relaxation of the smooth muscle. So that means it's going to be smooth muscle relaxation. Smoother relaxation is going to cause vasodilation. Is going to cause hypotension. So that means that the stimulation of the M3 is good to decrease basically your pressure, hypotension. What about if I inhibit my M3? Well, now it's going to be the different things, the opposite. So smooth muscle contraction. So smooth muscle contraction. What else? Vasoconstriction and hypertension. Vasoconstriction and hypertension. Yeah. So now we are going to see the eyes. Yeah, so let's say the M3 receptors in the eye. So let's just so let's see what's going on here. Just trace this again because it doesn't look so good. There you go. Yeah, M3 in the eyes is here. Whoops. What about if I stimulate? So imagine your M3 receptor inside of your eyes. If you stimulate your eyes, if you stimulate your M3 in your eyes, so it's going to cause pupillary sphincter muscle contraction. Oh, do you remember where M3 also caused contraction? Yes, that was in the bladder. Okay, also in the lungs. Okay, so when you stimulate it, also in the heart. No, the heart was different, so that decreased your contraction. Okay, yeah, but the M3 in the eyes is going to cause pupillary sphincter muscle contraction. So muscle contraction, we can put a name. So this is called meiosis. Okay, also that is more muscles, so the other is ciliary muscle contraction. Okay, and then the ciliary muscle contraction, it is for accommodation. Got it. So this is M3 stimulation in the eyes because pupillary sphincter muscle contraction, and if you contract your pupillary sphincter, it causes meiosis. Or also you can cause contraction in the ciliary muscle, which is for accommodation. But what about if I inhibit? Now I'm inhibiting the M3, I'm blocking M3 in your eyes, so it's going to cause, instead of meiosis, it's going to cause mydriasis. Mydriasis is dilation of the pupils, so it's going to cause mydriasis. Okay, so mydriasis, and it's going to cause cycloplegia. Okay, so just to remember that cycloplegia is paralysis of the ciliary muscle. Do you remember that we talked about ciliary muscle of the eye? Yeah, ciliary muscle. So that means that this cycloplegia is paralysis of the ciliary muscle. So when you inhibit your M3 in the eyes, also this can may precipitate. What do you think is going to precipitate one disease that is not that fun? Acute angle glaucoma. Acute angle glaucoma. What kind of patient are highest risk of that? In elderly patients. Okay, in elderly patients. Okay, so now we are going to continue with M3, but now we're going to enter into another system, and you're going to see here it's called now we continue with the M3, and the one that we're going to talk about is gastrointestinal. So gastrointestinal. So in your gastrointestinal system, if you stimulate your M3, so it's going to increase your peristalsis, which that's good. If it's not in excess, because if it's in excess, you can get diarrhea. But if it's in normal and you increase your M3, you increase your peristalsis, which is the movement of your peristalsis is the movement of your GI system, so from esophagus, stomach, intestine, so on. So you increase your peristalsis when you stimulate your M3. Also, you increase your salivary and gastric secretion. So that means that your M3 stimulation helps you to have better digestions. So you remember that the digestion start in your mouth. So and then you start to salivate when you smell or when you see food. Yes. So, and who is causing this? M3. Because why? Because receiving a stimulation. Okay. So now, what about if I inhibit the M3 in the gastrointestinal system? Well, you are not going to have peristalsis, so that means that the patient is going to have constipation. Okay. What else do you think the patient is going to have? Well, no production of saliva, so it's going to be dry mouth. Okay. So what else? So also decrease your acid production. So decrease your acid production. Okay. So yeah. Just to recap, so we saw M1, M2, and M3. We saw M1 in the brain, M2 in the heart. So let's just see. And then M3 we saw in the peripheral vasculature, in the lung, in the bladder, in the eyes, in the gastrointestinal, and the skin. Okay, in 6 places. Got it? So, well, this is all about the muscarinic receptors, and thank you so much, and we can do all things through gastrointestinals, and God bless you.